Various pathogens can cause skin infections, such as bacteria, viruses, fungi, and parasites. The symptoms, treatment, and outlook will depend on the cause. Infections can vary from mild to serious. Most skin infections are highly treatable. However, an infection can become more serious if it goes deeper into the skin or spreads across much of the body. People with a weakened immune system have a higher risk of skin infections and complications from skin infections. This could be due to a health condition such as HIV, diabetes, poor circulation, or malnutrition. A side effect of medication such as chemotherapy or biologic drug use. Being older or very young. Have skin folds due to obesity. Over-the-counter medications and home remedies can often treat mild infections, but other infections may need medical attention. Read on to learn more about skin infections and what to do if you have one. What are the types of skin infections? The following are 4 different types of skin infections. 1. Bacterial skin infections. Bacterial skin infections occur when bacteria enter the skin either from an outside source or because they are present on the skin. They can enter the skin through a hair follicle or after a wound. Anthrax is one type of bacterium that can enter from the environment. Staphylococcus and Streptococcus are bacteria that are commonly present on the skin and only cause a problem in certain circumstances. Lyme disease is a tick-borne infection that causes skin symptoms. Bacterial infections can be systemic or local. Systemic infections can cause symptoms throughout the whole body, such as a fever, while local infections only affect a specific area. Some bacterial infections can begin in one area and spread throughout the body. Some bacterial skin infections, such as impetigo, can spread between people through direct skin contact or with bodily fluids, contaminated food or water, or by touching surfaces where bacteria are present. Others, such as cellulitis, are not contagious. Different types of bacterial skin infections include cellulitis, impetigo, boils, Hansen's disease, leprosy. Systemic infections that can cause skin rashes include syphilis, tuberculosis, leptospirosis. Some bacterial infections are mild and easy to treat with topical antibiotics, but other infections require an oral antibiotic or other medical treatment. 2. Viral skin infections. Viruses can cause different types of infections that have skin symptoms such as shingles, herpes zoster, chickenpox, molluscum contagiosum, warts, measles, hand, foot, and mouth disease. These viruses are often contagious, and most are systemic. 3. Fungal skin infections. These types of skin infections are caused by a fungus and are most likely to develop in moist areas of the body where surfaces meet, such as the feet, armpit, or where there are skin folds. In some cases, an allergy to the fungus causes symptoms in other areas that are not directly affected. For instance, a person with a fungal infection on the foot might develop a rash on their fingers. It doesn't happen because the person touched their foot. Different types of fungal infections. Athlete's foot, yeast infection, ringworm, nail fungus, oral thrush, diaper rash. 4. Parasitic skin infection. These types of skin infections are caused by a parasite. These infections can spread beyond the skin to the bloodstream and organs. A parasitic infection isn't life-threatening but can be uncomfortable. Different types of parasitic skin infections include lice, bedbugs, scabies, cutaneous larva migrans. What are the symptoms of a skin infection? The symptoms of a skin infection will depend on the type of infection, the cause, Individual factors, such as whether the person has a weakened immune system. Common symptoms of skin infections include redness on pale skin, or purple or darker areas of skin if you have a darker skin tone. Lesions that may be flat or raised, bumpy, wart-like, and so on. Itching. Pain and tenderness. In some cases, a person may also have other symptoms, such as a fever. Signs of a severe infection include pus, blisters, skin sloughing, breakdown, dark areas that can indicate necrosis or tissue death, pain and discoloration, widespread swelling. Is this rash an infection or another skin disorder? Causes and risk factors for a skin infection. Some types of pathogens, notably bacteria and fungi, are typically present on the skin, but if they become too numerous, the immune system can no longer manage them. In this case, an infection can result. The cause of a skin infection depends on the pathogen involved. Bacterial skin infection. These infections occur when bacteria enter the body through a break in the skin, such as a cut or a scratch. Not all cuts or scratches lead to a skin infection, but there is a higher risk if you have a weakened immune system. Do not keep the wound clean. Are exposed to certain bacteria, for example, when working outside. Viral skin infection. The most common viruses come from one of three groups of viruses. Poxviruses, such as trusted source. Molluscum contagiosum. Smallpox. Pox. Human papillomavirus (HPV), responsible for genital warts. Herpes viruses, which can lead to herpes simplex viruses, HSV. Varicella-Zoster virus, which causes chickenpox and shingles. Epstein-Barr virus, EBV, which can lead to mononucleosis. Cytomegalovirus, CMV. Experts still don't know how prevalent viruses are on the skin, unlike bacteria and fungi. Fungal infection. Body chemistry and lifestyle factors can increase the risk of a fungal infection. Fungi often grow in warm, moist environments. Some risk factors for a fungal infection are having sweaty feet or wearing closed footwear, wearing sweaty or wet clothes, having skin folds due to excess body fat, bathing in contaminated water, sharing personal items with other people who carry a fungus or have an infection. A break or cut in the skin may allow pathogens to get into the deeper layers of the skin. Parasitic skin infection. Tiny insects or organisms burrowing underneath your skin and laying eggs can cause a parasitic skin infection. Examples include scabies, an infestation of mites, which causes itching, a rash of small pimples, lines on the skin surface, and scaling or crusty skin. Pediculosis, this is an infection caused by lice. It can cause itching, and lice and nits, their eggs, may be visible. Creeping eruption, caused by hookworms, this can cause a winding, snake-like rash. When to see a doctor. See a doctor if you have pus-filled blisters, severe or widespread swelling or inflammation, a skin infection that doesn't improve or gets progressively worse, a high fever or other symptoms, frequent or recurring rashes or infections. Skin infections can spread beyond the skin and into tissues under the skin or the bloodstream, especially in people with a compromised immune system. When this happens, it can lead to sepsis, a potentially life-threatening condition. If you need help finding a dermatologist, then check out our Find Care tool here. Treatment. Treatment depends on the cause of the infection and the severity. Some infections will go away on their own or respond to over-the-counter creams. If an infection is severe, the person is at risk of complications, or the infection is contagious, a doctor may prescribe medication such as antibiotics, antivirals, antifungals, Antiparasitics. The form of the medication will partially depend on the severity of the infection or the risk of complications. A person with a severe infection may need to spend time in the hospital. Home care and alternative treatments. Home care for a skin infection works to reduce symptoms. Here are some tips. Apply cold compresses to your skin several times a day to reduce itching and inflammation. Take over-the-counter antihistamines to decrease itching. Use topical creams and ointment to reduce itching and discomfort. Outlook for a skin infection. The outlook will depend on the cause, type, and severity of the infection. Many skin infections respond well to medication. However, some conditions, such as methicillin-resistant Staphylococcus aureus, MRSA, are resistant to common antibiotics and harder to treat. Skin infection prevention. Ways of reducing the risk of a skin infection or rash include washing regularly, drying the body to remove all moisture, avoiding sharing personal items with other people, checking the skin regularly for changes and seeking advice as soon as signs of an infection appear, having the recommended vaccinations to prevent diseases such as chickenpox. Frequently asked questions. What are the main types of skin infections? Skin infections can be bacterial, commonly caused by streptococcal or staphylococcal bacteria. Viral, such as chickenpox or warts. Fungal, for instance, a yeast infection. Parasitic, for example, scabies. What does a bacterial skin infection look like? This will depend on the infection, but it will usually involve inflammation and swelling. What is the most common bacterial infection of the skin? Impetigo is a common example of a bacterial infection. Others include cellulitis and Lyme disease. The most common bacteria associated with skin infections are the Staphylococcus and Streptococcus species. Takeaway. Skin infections can result from bacterial, viral, fungal, and parasitic causes. The way they affect the body will depend on the specific pathogen. Some cause skin symptoms as part of a wider infection, while others cause local symptoms only. Skin infections are often highly treatable, but severe symptoms and complications can arise if a person has a weakened immune system. Some infections are contagious, such as scabies, and people need to take care not to pass them on before or during treatment. See your doctor if you have any concerns about signs of a skin infection. Impetigo is a bacterial infection that affects the skin, causing sores and blisters. It can appear differently depending on the stage of infection and what part of the body it affects. What is impetigo? Impetigo is a common contagious skin infection. Bacteria like Staphylococcus aureus or Streptococcus pyogenes infect the outer layers of the skin, called the epidermis. The face, arms, and legs are most often affected. Anyone can get impetigo, but it most commonly affects children, especially those ages 2 to 5. The infection often begins in minor cuts, insect bites, or a rash such as eczema, any place where the skin is broken. But it can also occur on healthy skin. It's called primary impetigo when it infects healthy skin and secondary impetigo when it occurs in broken skin. It isn't always easy or necessary to make this distinction. Impetigo is an old disease. The name dates back to 14th century England and comes from the Latin word impetire, meaning to attack. Bacteria thrive in hot, moist conditions. So, impetigo tends to be seasonal, peaking in the summer and fall in northern climates. In warm and humid climates, it tends to occur year-round. An estimated 162 million children trusted source worldwide have impetigo at any one time, according to a 2015 review. The review noted that Australia, New Zealand, and North America were excluded because those studies were conducted on small, under-resourced populations that may not have reflected the overall statistics. Impetigo is more common in developing countries and in lower-income areas of industrial countries. The highest numbers of cases are in areas like Oceania, which includes Australia, New Zealand, and several other countries. Impetigo symptoms. The first signs of impetigo are reddish sores on the skin, often clustered around the nose and lips. These sores quickly grow into blisters, ooze and burst, and then form a yellowish crust. The clusters of blisters may expand to cover more of the skin. Sometimes, the red spots just develop a yellowish crust without any blisters being seen. The sores can be itchy and occasionally painful. After the crust phase, they form red marks that fade without leaving scars. Infants sometimes have a less common type of impetigo, with larger blisters around the diaper area or in skin folds. These fluid-filled blisters soon burst, leaving a scaly rim called a collarette. Impetigo can be uncomfortable. Occasionally, it may involve a fever or swollen glands in the area of the outbreak. Because impetigo can occur on any part of the skin, it may take on a slightly different appearance for different people. It will also look different depending on the stage of the infection. Below are example pictures of impetigo on a variety of skin tones. What causes impetigo? Impetigo is an infection caused by strains of Staphylococcus, staph, or Streptococcus, strep, bacteria. These bacteria can get into your body through a break in the skin from a cut, scratch, insect bite, or rash. Then, they can invade and colonize. The condition can be contagious. You can catch these bacteria if you touch the sores of a person with impetigo or you touch items like towels, clothes, or sheets that the person used. However, these bacteria are also common in our environment, and most people who come in contact with them won't necessarily develop impetigo. Some people normally carry staph bacteria on the inside of their nose. They may get an infection if the bacteria spreads to their skin. Adults and children are at higher risk of impetigo if they live in a warm, humid climate, have diabetes, have a compromised immune system, such as from HIV or AIDS, have skin conditions such as eczema, dermatitis, or psoriasis, have a sunburn or other burns, have itchy infections such as lice, scabies, herpes simplex, or chickenpox, have insect bites or poison ivy, play contact sports. Who's at risk of impetigo? While anyone can contract impetigo, close contact with someone who already has the infection is the most common risk factor trusted source for the condition. Impetigo spreads more easily when people are in close quarters, such as in households, schools, daycares, prisons, military training facilities. Age is also a significant risk factor for impetigo. The more common non-bullous variety is seen most often in children 2 to 5 years old. The less common bullous variety occurs in children younger than 2 in 90% trusted source of cases. When impetigo does occur in adults, it is more common in men. Having cuts and scrapes can increase your risk of impetigo. Be aware of activities that might break your skin, and wear appropriate protective equipment or clothing when possible. Open wounds should be cleaned and bandaged. Living in a hot or humid climate will increase your risk of impetigo, but it can occur anywhere. Having poor personal hygiene increases your risk of impetigo as well. You can decrease your risk with proper hand washing, regular body washing, keeping your face clean. Potential complications from impetigo. The bacteria responsible for impetigo can cause complications including other more serious infections and harmful immune responses. Staphylococcal scalded skin syndrome. Impetigo is caused by the bacteria Staphylococcus aureus in 80% trusted source of cases. This bacterium triggers the release of certain toxins. In the local area around the infection, these toxins can lead to impetigo. If the toxins spread more generally around the body, this can lead to staphylococcal scalded skin syndrome, SSSS. Soft tissue infection. The bacteria that cause impetigo can cause other skin and soft tissue infections, including necrotizing fasciitis. Medical emergency. Any skin or soft tissue infection that you notice spreading rapidly should be treated as a medical emergency. Call 911 or go to the nearest emergency room. Toxic shock syndrome. The same bacteria that cause impetigo can also cause toxic shock syndrome. When the bacteria leave the skin and enter the bloodstream, toxic shock syndrome can arise as a complication. The symptoms are usually felt rapidly. It is a potentially life-threatening condition that needs medical attention. Medical emergency. Toxic shock syndrome is a medical emergency. Call emergency services or go to the nearest emergency room if you experience fever, low blood pressure, decreased alertness or increased confusion, vomiting, fast breathing, fast heart rate, rheumatic fever. Group A streptococcus is the bacteria responsible for strep throat and scarlet fever, and it can sometimes cause impetigo. After having one of these infections, your body's immune system may respond with inflammation in the form of rheumatic fever. Because rheumatic fever is an immune response, it's not contagious, but the underlying infections can be. Rheumatic fever most often affects children ages 5 to 15. Trusted source, although it can develop at any age. It should be treated right away to avoid long-term complications. Diagnosing impetigo. It's a good idea to see a doctor if you suspect impetigo. They can usually diagnose the infection by its appearance. If the sores don't clear up with treatment, the doctor may want to culture the bacteria. This involves taking a little bit of the liquid that comes out of the sore and testing it to see what type of bacteria caused it to determine which antibiotics will work best against it. Treatment of impetigo. Antibiotics are effective against impetigo. The type of antibiotic you get depends on how widespread or severe the lesions are. If you have impetigo in only a small area of your skin, topical antibiotics are the preferred treatment. Options include mupirocin cream or ointment, Bactroban or Centeni, and ribupamulin ointment, Altobax. If your impetigo is severe or widespread, your doctor can prescribe oral antibiotics such as amoxicillin/clavulanate, Augmentin, certain cephalosporins, clindamycin, Cleocin. These drugs may work more quickly than topical antibiotics, but they aren't necessarily better at clearing the infection. Oral antibiotics can also cause more side effects, such as nausea, than topical antibiotics. With treatment, impetigo usually heals in 7 to 10 days. If you have an underlying infection or skin disease, the infection may take longer to heal. Impetigo on adults. Although impetigo is more common in young children, adults can get it too. Because it's so contagious, impetigo can spread through any close contact. Adults who play sports often catch it from skin-to-skin contact. The symptoms of impetigo in adults are sores around the nose and mouth or other exposed areas of the body. These sores break open, ooze, and then crust. Generally, impetigo is a mild skin condition, but adults have a higher risk of complications than children. These complications may include acute post-streptococcal glomerulonephritis, which most commonly trusted source affects children and older adults, cellulitis, lymphangitis, sepsis. Impetigo isn't the only infectious rash adults can get. Here are a few other contagious skin conditions. Impetigo on toddlers. Toddlers are the most likely age group to develop impetigo. The infection looks different on young children than it does on adults. Parents may see sores on their child's nose and mouth area, trunk, torso, hands, feet, diaper area. In young children, often the cause is scratching at an insect bite or scrape on the skin. Scratching allows bacteria to get into the skin. Continuing to scratch can cause a more serious infection or lead to scarring. Parents can help prevent complications by covering the sores and cutting their child's nails. Stages of impetigo by type. There are 3 types of impetigo based on the bacteria that cause them and the sores that form. Each type goes through a series of stages. Non-bullous. Non-bullous impetigo is mainly caused by Staphylococcus aureus. It's the most common form of impetigo, causing an estimated 70% trusted source of cases, according to a 2014 review. It goes through the following stages. It usually starts with reddish, itchy sores around the mouth and nose. The sores break open, leaving red and irritated skin around them. A brownish-yellow crust forms. When the crusts heal, there are reddish spots that fade and don't leave scars. Bullous. Bullous impetigo is almost always caused by Staphylococcus aureus bacteria. It usually forms larger blisters, or bulli, filled with a clear fluid that may become darker and cloudy. The blisters start on unbroken skin and aren't surrounded by reddish areas. The blisters become limp and clear and then burst open. A yellowish, crusty sore forms over the area where the blisters broke open. The blisters usually leave no scars behind when they heal. Ecthyma. This infection is more serious, but much less common. It occasionally happens when impetigo isn't treated. Ecthyma goes deeper into the skin than the other forms of impetigo, and it's more severe. The infection forms painful blisters on the skin of the buttocks, thighs, legs, ankles, and feet. The blisters turn into pus-filled sores with a thicker crust. Often, the skin around the sores turns red. Ecthyma sores heal slowly and may leave scars after they heal. Home treatment options for impetigo. Antibiotics are the main treatment for impetigo, but you may be able to help the infection heal faster with home treatments in addition to treatment recommended by your doctor. Warm water and OTC antibiotics. Clean and soak the sores 3 to 4 times a day until the sores heal. Gently clean the sores with warm water and soap, and then remove the crusts. Wash your hands thoroughly after treating the sores to avoid spreading the infection. Dry the area and apply the prescription antibiotic ointment as directed. Then, cover the sores lightly with gauze if they are in an area where you can do this. For a minor outbreak, you can use an over-the-counter, OTC, antibiotic ointment. Apply it 3 times a day after cleaning the area. Then, cover the sore with a bandage or gauze. After a few days, if you don't see improvement, you should see a doctor. Household bleach. Another home treatment is a 15-minute bath with a very dilute solution of household bleach, 2.2%. This reduces the number of bacteria on the skin if you use it regularly. For a full-size bath, use half a cup of bleach. Rinse off with warm water and pat dry afterward. Use caution if you have sensitive skin. Some people have an allergic reaction to bleach. Additionally, supervision is necessary around bathwater and when using any bleach or other home remedies to avoid drownings or accidental ingestion. Other remedies. A number of home remedies are also available at your drugstore or natural products store. Using them correctly might improve the odds that they'll help your impetigo, though they haven't been shown to effectively treat impetigo on their own. Essential oils for impetigo. Essential oils are liquids extracted from plants. Dozens of essential oils have antibacterial properties. This suggests that essential oils may be a useful remedy for impetigo, though currently there is no research to support this. These products could have advantages over antibiotics because some of the bacteria that cause impetigo have become resistant to current antibiotic drugs. A few of the essential oils that may help remedy impetigo are geranium oil, patchouli oil, tea tree oil. Before you try any essential oil or other alternative treatment, speak with a doctor. Some of these products can cause side effects, and they may not be safe for everyone. Make sure to dilute essential oil in a carrier oil before applying it to our skin. Don't apply it in or around your eyes. Preventing impetigo. If the lesions can't be reliably covered, children with impetigo should stay home until they no longer have an active infection that can be passed to others. Adults who work in jobs that involve close contact should ask their doctor when it's safe for them to return to work. Good hygiene is the best way to prevent impetigo. Follow these tips. Bathe and wash your hands often to cut down on skin bacteria. Cover any skin wounds or insect bites to protect the area. Keep your nails clipped and clean. Don't touch or scratch open sores. This can spread the infection. Wash everything that comes into contact with the impetigo sores in hot water and laundry bleach. Change bed linens, towels, and clothing that come into contact with the sores often, until the sores are no longer contagious. Clean and disinfect surfaces, equipment, and toys that may have come into contact with impetigo. Don't share any personal items with someone who has impetigo. Is impetigo contagious? The open sores are highly contagious. Scratching the sores can spread the infection from one place on your skin to another, or to another person. The infection can also spread from anything touched by a person with an impetigo infection. Because it spreads so easily, impetigo is sometimes called the school disease. It can quickly spread from child to child in a classroom or day care center where children are in close contact. For the same reason, it also spreads easily in families. Hygiene is key to controlling impetigo spread. If you or your child has impetigo, wash and disinfect everything the infection might come into contact with, including clothes, bedding, towels, toys, sports equipment. Topical antibiotics, such as mupirocin, can usually clear up impetigo in a few days and shorten the length of time that the infection is contagious. Oral antibiotics stop the infection from being contagious after 24 to 48 hours. Impetigo versus cold sore. Like impetigo, cold sores are blisters that form around your mouth. You might also see them on your nose or fingers. Cold sores are caused by the herpes simplex virus (HSV). This virus comes in two forms, HSV-1 and HSV-2. Usually, HSV-1 causes cold sores, while HSV-2 causes genital herpes. Antiviral creams and pills treat cold sores if necessary. You can spread or catch the virus that causes cold sores through kissing. The sores remain infectious until they crust over, so avoid kissing anyone who has never had cold sores until that time. Cold sores form in 5 stages. Learn what to expect after you see one pop up. Impetigo versus ringworm. Ringworm is a fungal infection of the skin. The name refers to the ring-like shape of the red, raised skin patches it produces. Unlike impetigo, ringworm doesn't cause yellow crusting. You can catch ringworm through direct contact or by sharing personal items with people who have a ringworm infection. The ring may appear on the scalp, body, skin around the groin, called jock itch, feet, called athlete's foot. The typical treatment is with an antifungal skin cream. Some products are available over the counter. Others require a prescription from a doctor. Ringworm can be itchy and annoying. Good hygiene can help prevent it or keep it from coming back. Impetigo versus erysipelas. Erysipelas is a bacterial infection that affects the upper layers of skin. It's caused by the same strep bacteria that are responsible for strep throat. Similar to impetigo, these bacteria sneak into the skin through an open wound or crack. Erysipelas causes blisters on the face and legs. Other symptoms include a fever and chills. Doctors typically prescribe oral antibiotics to treat the infection. More severe cases may need to be treated with intravenous, antibiotics in a hospital. Treatment is usually very effective at eliminating the infection. Not treating erysipelas can increase your risk of serious complications. Impetigo versus eczema. Eczema isn't an infection. Instead, it can be a reaction to substances in your environment, like detergent, metal, or latex, or it may be associated with allergies or asthma. Symptoms of eczema include red, itchy skin, dry skin. One type, called dyshydrotic eczema, causes tiny fluid-filled blisters to form on your hands or feet. These blisters may itch or hurt. People who have allergies are more likely to get eczema. Avoiding the substance that caused the skin reaction can prevent it in the future. Eczema comes in 7 different types. Learn how to identify them. Takeaway. Impetigo is a highly contagious bacterial skin infection that generally isn't serious. It clears up faster with antibiotics and requires good hygiene to prevent it from spreading. If you suspect that you or a loved one has impetigo, contact a doctor for diagnosis. What is necrotizing fasciitis? Necrotizing fasciitis is a type of soft tissue infection. It can destroy the tissue in your skin and muscles as well as subcutaneous tissue, which is the tissue beneath your skin. Necrotizing fasciitis is most commonly caused by an infection with group A streptococcus, commonly known as flesh-eating bacteria. This is the fastest-moving form of the infection. When this infection is caused by other types of bacteria, it typically doesn't progress as quickly and isn't quite as dangerous. This bacterial skin infection is rare in healthy people, but it's possible to get this infection from even a tiny cut, so it's important to be aware of the symptoms if you're at risk. You should see your doctor immediately if you have symptoms or believe that you may have developed the infection. Because the condition can progress quickly, it's vital to treat it as early as possible. What are the symptoms of necrotizing fasciitis? The first symptoms of necrotizing fasciitis may not seem serious. Your skin may become warm and red, and you may feel as if you pulled a muscle. You may even feel like you simply have the flu. You can also develop a painful, red bump, which is typically small. However, the red bump doesn't stay small. The pain will become worse, and the affected area will grow quickly. There may be oozing from the infected area, or it may become discolored as it decays. Blisters, bumps, black dots, or other skin lesions might appear. In the early stages of the infection, the pain will be much worse than it looks. Other symptoms of necrotizing fasciitis include fatigue, weakness, fever with chills and sweating, nausea, vomiting, dizziness, infrequent urination. What causes necrotizing fasciitis? To get necrotizing fasciitis, you need to have the bacteria in your body. This typically occurs when the skin is broken. For example, the bacteria can enter your body through a cut, scrape, or surgical wound. These injuries don't need to be large for the bacteria to take hold. Even a needle puncture can be enough. Several types of bacteria cause necrotizing fasciitis. The most common and well-known type is group A streptococcus. However, this isn't the only type of bacteria that can cause this infection. Other bacteria that can cause necrotizing fasciitis include Aeromonas hydrophila, Clostridium, E. coli, Klebsiella, Staphylococcus aureus. Risk factors for necrotizing fasciitis. You can develop necrotizing fasciitis even if you're perfectly healthy, but this is rare. People who already have health issues that weaken the immune system, such as cancer or diabetes, are at greater risk. Trusted source of developing infections caused by group A Streptococcus. Other people who are at greater risk for necrotizing fasciitis include those who have chronic heart or lung disease, use steroids, have skin lesions, abuse alcohol or inject drugs. How is necrotizing fasciitis diagnosed? In addition to looking at your skin, your doctor may perform several tests to diagnose this condition. They may take a biopsy, which is a small sample of the affected skin tissue, for examination. In other cases, blood tests, CT, or MRI scans may help your doctor make a diagnosis. Blood tests can show if your muscles have been damaged. How is necrotizing fasciitis treated? Treatment begins with strong antibiotics. These are delivered directly into your veins. The tissue decay means that the antibiotics might not be able to reach all of the infected areas. As a result, it's important for doctors to remove any dead tissue immediately. In some cases, amputation of one or more limbs may be necessary to help stop the spread of the infection. What's the outlook? The outlook depends entirely on the severity of the condition. Early diagnosis is crucial for this dangerous, life-threatening infection. The earlier the infection is diagnosed, the earlier it can be treated. Without prompt treatment, this infection can be fatal. Other conditions that you have in addition to the infection can also have an impact on the outlook. Those who recover from necrotizing fasciitis may experience anything from minor scarring to limb amputation. It may require multiple surgical procedures to treat and then additional procedures such as delayed wound closure or skin grafting. Each case is unique. Your doctor will be able to give you more specific information about your individual case. How can I prevent necrotizing fasciitis? There's no sure way to prevent a necrotizing fasciitis infection. However, you can reduce your risk with basic hygiene practices. Wash your hands frequently with soap and treat any wounds promptly, even minor ones. If you already have a wound, take good care of it. Change your bandages regularly or when they become wet or dirty. Don't put yourself in situations where your wound could become contaminated. The Centers for Disease Control and Prevention, CDC, trusted source lists hot tubs, whirlpools, and swimming pools as examples of places you should avoid when you have a wound. Go to your doctor or the emergency room immediately if you think there's any chance you may have necrotizing fasciitis. Treating the infection early is very important to avoid complications. Cellulitis is a common bacterial skin infection that can cause the skin to become painful and discolored. If left untreated, the infection can spread to other parts of the body and cause serious complications. In fact, there are over 14 million trusted source cases of cellulitis in the United States each year. The infection can occur anywhere on the body and can lead to serious complications if it goes untreated. In this article, we discuss the causes, treatments, and symptoms of cellulitis. Read on to learn more. What is cellulitis? Cellulitis is an often painful skin infection. It may first appear as a discolored, swollen area that feels hot and tender to the touch. The discoloration and swelling can spread quickly. On lighter skin tones, cellulitis will typically appear red or pink. On darker skin tones, it may appear dark brown, gray, or purple. Its most often trusted source affects the feet and lower legs, although the infection can occur anywhere on a person's body or face. Cellulitis affects the skin trusted source and the tissues underneath. The infection can spread to your lymph nodes and bloodstream. If you don't treat cellulitis, it could become life-threatening. Get medical help right away if you have symptoms. What causes cellulitis? Cellulitis occurs when certain types of bacteria enter the skin through a break in its surface. Staphylococcus and Streptococcus strep bacteria commonly cause cellulitis. Cellulitis can start in skin injuries such as cuts, bug bites, surgical wounds. What are the risk factors for cellulitis? Several factors increase your risk. Trusted source of cellulitis. For example, you're more likely to develop cellulitis if you have a skin condition like eczema or athlete's foot. This is because bacteria can enter your skin through cracks caused by these conditions. A weakened immune system also increases your risk of developing cellulitis because it can't provide as much protection against the infection. Other risk factors include having a cut, scrape, or other injury to the skin, diabetes, swelling in your arms or legs, lymphedema, obesity. What are the symptoms of cellulitis? Cellulitis symptoms include pain and tenderness in the affected area, redness or inflammation of your skin, a skin sore or rash that grows quickly, tight, glossy, swollen skin, a feeling of warmth in the affected area, an abscess with pus, fever. More serious cellulitis symptoms include shaking, chills, feeling ill, fatigue, dizziness, lightheadedness, muscle aches, warm skin, sweating. Cellulitis can spread into other parts of your body if left untreated. If it does spread, you may develop some of the following symptoms: drowsiness, lethargy, fatigue, blisters, red or dark brown streaks on the skin. Contact your doctor right away if you have symptoms of cellulitis. Is cellulitis contagious? Cellulitis usually doesn't spread from person to person. It is possible to catch a bacterial skin infection if you have an open cut on your skin and it touches skin that has an active infection. If you do develop cellulitis from a transmitted infection, it could be dangerous if you don't treat it in a timely manner. This is why it's important to tell your doctor as soon as you notice symptoms of cellulitis. Are there complications of cellulitis? Complications of cellulitis can be severe if left untreated. Some complications can include severe tissue damage, gangrene, amputation, damage to internal organs that become infected, septic shock, death. How is cellulitis diagnosed? Your doctor will likely be able to diagnose cellulitis just by looking at your skin. A physical exam might reveal swelling of the skin, redness and warmth of the affected area, swollen glands. Depending on the severity of your symptoms, your doctor may want to monitor the affected area for a few days to see if the discoloration and swelling spread. In some cases, your doctor may take blood or a sample of the wound to test for bacteria. If you need help finding your primary care doctor, then check out our Find Care tool here. How is cellulitis treated? Cellulitis treatment typically involves taking antibiotics by mouth for a minimum of 5 days. Trusted source. Your doctor may also prescribe pain relievers. However, in some cases, doctors will administer intravenous antibiotics as soon as they diagnose symptoms. You should rest until your symptoms improve. Raising the affected limb higher than your heart can also help reduce swelling. Cellulitis should go away within 7 to 10 days after you start taking antibiotics. You might need longer treatment if your infection is more severe. Even if your symptoms improve within a few days, it is critical to take all the antibiotics your doctor prescribes. When to contact a doctor? Contact your doctor if you don't feel better within 3 days after starting antibiotics. Notice your symptoms get worse. Develop a fever. You may need to be treated with 4 antibiotics in a hospital if you have a high temperature, low blood pressure, an infection that doesn't improve with oral antibiotics, a weakened immune system due to other diseases. Surgery options. In most cases, a course of antibiotics will clear up the infection. However, if you have an abscess, a medical professional may need to drain it. For surgery to drain the abscess, you first get medication to numb the area. Then, the surgeon makes a small cut in the abscess and allows the pus to drain out. The surgeon then covers the wound with a dressing so it can heal. You may have a small scar afterward. Home remedies. You should always see your doctor first if you have symptoms of cellulitis. Without treatment, it can spread and cause a life-threatening infection. However, there are things you can do at home to relieve pain and other symptoms. For a start, you can clean your skin in the area where you have cellulitis. Ask your doctor how to properly clean and cover your wound. For example, if your leg is affected, raise it above the level of your heart. This will help reduce swelling and relieve pain. Here's how to take care of your skin at home while you recover from cellulitis. How long does it take to recover from cellulitis? Your symptoms may worsen for the first 48 hours. However, they should begin to improve 2 to 3 days after you start taking antibiotics. You should always finish any course of antibiotics your doctor prescribes. During your recovery, keep the wound clean. Follow your doctor's recommendations for washing and covering the affected area of the skin. Can you prevent cellulitis? If you have a break in your skin, clean it right away and apply antibiotic ointment. Cover your wound with ointment and a bandage until it's fully healed. Change the bandage daily. Watch your wounds for discoloration, drainage, or pain. These could be signs of an infection. Take these precautions if you have poor circulation or a condition that increases your risk of cellulitis. Keep your skin moist to prevent cracking. Promptly treat conditions that cause cracks in the skin, like athlete's foot. Wear protective equipment when you work or play sports. Inspect your feet daily for signs of injury or infection. What other conditions may be confused with cellulitis? Many conditions can present symptoms similar to cellulitis. Cellulitis versus venous stasis. Venous stasis, or venous stasis dermatitis, is a condition commonly misdiagnosed as cellulitis. According to the National Eczema Association, venous stasis causes swelling and discoloration, and it can develop into skin ulcers. It is the result of poor circulation in the lower limbs and typically affects the lower legs and ankles. Unlike cellulitis, this condition can affect both sides of the body and is not the result of bacterial infection. However, your risk of a skin infection will increase if you develop sores or ulcers as a result of venous stasis. Cellulitis versus erysipelas. Cellulitis versus erysipelas. Erysipelas is another skin infection. Like cellulitis, it can start from open wounds, burns, or surgical cuts. Most of the time, the infection is on the legs. Less often, it can appear on the face, arms, or trunk, torso. However, cellulitis affects deeper tissue, while erysipelas is often the result of strep bacteria, and its effects are more superficial. Other symptoms of erysipelas include fever, headache, nausea, chills, weakness, ill feeling. Doctors treat erysipelas with antibiotics, most often penicillin or a similar drug. Cellulitis versus abscess. An abscess is a swollen pocket of pus underneath the skin. It forms when bacteria, often Staphylococcus, get into your body through a cut or other open wound. When this happens, your immune system sends in white blood cells to fight off the bacteria. The attack can form a hole under your skin, which fills with pus. The pus contains dead tissue, bacteria, and white blood cells. Unlike cellulitis, an abscess looks like trusted source, a lump under the skin. You may also have symptoms like a fever and chills. Some abscesses shrink on their own without treatment. In other instances, you may require antibiotics. In general, abscesses need to open and drain in order to improve. Cellulitis versus dermatitis. Dermatitis is a general term for a skin rash, and it covers many conditions. These include atopic dermatitis, eczema, contact dermatitis, an allergic reaction to an irritating substance. Unlike cellulitis, most forms of dermatitis are not due to bacterial infections. Learn more about the types of dermatitis here. General dermatitis symptoms include discolored skin, blisters that ooze or crust, itching, swelling, scaling. Doctors treat dermatitis with cortisone creams and antihistamines to relieve the swelling and itching. You will also need to avoid the substance that caused the reaction. Cellulitis versus DVT. Deep vein thrombosis, DVT, is a blood clot in one of the deep veins, usually in the legs. You can get trusted source a DVT after you sit or lie in bed for a long period of time, such as on a long plane trip or after surgery. Symptoms of DVT include pain in the leg, redness, warmth. It's important to get medical help if you have DVT. If the clot breaks free and travels to the lungs, it can cause a life-threatening condition called pulmonary embolism, PE. Doctors treat DVT with blood thinners. These prevent the clot from getting bigger and stop you from getting new clots. Takeaway. Cellulitis is a common bacterial skin infection that causes inflammation, skin discoloration, and pain. Complications are uncommon trusted source, but can be severe. You should always contact your doctor if you develop symptoms of cellulitis. Most people fully recover from cellulitis after 7 to 10 days on antibiotics. If left untreated, cellulitis can lead to gangrene or septic shock and may require surgery in severe cases. It is possible to get cellulitis again in the future. You can help prevent this infection by keeping your skin clean if you get a cut or other open wound. Ask your doctor if you're unsure how to properly care for your skin after an injury. Athlete's foot, tinea pedis. You can typically treat athlete's foot with topical antifungal medications. Depending on the severity, a doctor may prescribe other medications. Athlete's foot, also called tinea pedis, is a contagious fungal infection that affects the skin on the feet. It can also spread to the toenails and the hands. The fungal infection is called athlete's foot because it's commonly seen in athletes. Athlete's foot isn't serious, but sometimes it's hard to cure. If you have diabetes or a weakened immune system and suspect you have athlete's foot, you should call your doctor right away. What causes athlete's foot? Athlete's foot occurs when the tinea fungus grows on the feet. You can catch the fungus through direct contact with someone who has it, or by touching surfaces contaminated with the fungus. The fungus thrives in warm, moist environments. It's commonly found in showers, on locker room floors, and around swimming pools. Who is at risk for athlete's foot? Anyone can get athlete's foot, but certain behaviors increase your risk. Factors that increase your risk of getting athlete's foot include visiting public places barefoot, especially locker rooms, showers, and swimming pools. Sharing socks, shoes, or towels with someone who has the infection. Wearing tight, closed-toe shoes. Keeping your feet wet for long periods of time. Having sweaty feet. Having a minor skin or nail injury on your foot. What are the symptoms of athlete's foot? There are many possible symptoms of athlete's foot, which include itching, stinging, and burning between your toes or on soles of your feet. Blisters on your feet that itch. Cracking and peeling skin on your feet, most commonly between your toes and on your soles. Dry skin on your soles or sides of your feet. Raw skin on your feet. Discolored, thick, and crumbly toenails. Toenails that pull away from the nail bed. How is athlete's foot diagnosed? A doctor may diagnose athlete's foot by the symptoms. Or, a doctor may order a skin test if they aren't sure a fungal infection is causing your symptoms. A skin lesion potassium hydroxide exam is the most common test for athlete's foot. A doctor scrapes off a small area of infected skin and places it in potassium hydroxide. The KOH destroys normal cells and leaves the fungal cells untouched, so they are easy to see under a microscope. How is athlete's foot treated? Athlete's foot can often be treated with over-the-counter, OTC, topical antifungal medications. If OTC medications don't treat your infection, your doctor may prescribe topical or oral prescription-strength antifungal medications. Your doctor may also recommend home treatments to help clear up the infection. OTC medications. There are many OTC topical antifungal medications, including miconazole, Desonex, terbinafine, Lamisil at, clotrimazole, Lotrimin AF, butenofine, Lotrimin Ultra, tolnaftate, Tinactin. Find these OTC antifungal medications on Amazon. Prescription medications. Some of the prescription medications your doctor may prescribe for athlete's foot include topical, prescription strength, clotrimazole or miconazole. Oral antifungal medications such as itraconazole, Sporanox, fluconazole, diflucan, or prescription strength terbinafine, Lamisil. Topical steroid medications to reduce painful inflammation. Oral antibiotics if bacterial infections develop due to raw skin and blisters. Home care. Your doctor may recommend that you soak your feet in salt water or diluted vinegar to help dry up blisters. Alternative therapy. Tea tree oil has been used as an alternative therapy for treating athlete's foot with some success. A study from 2002 reported that a 50% solution of tea tree oil effectively treated athlete's foot in 64% trusted source of trial participants. Ask your doctor if a tea tree oil solution can help your athlete's foot. Tea tree oil can cause contact dermatitis in some people. Find therapeutic grade tea tree oil on Amazon. Complications. Athlete's foot can lead to complications in some cases. Mild complications include an allergic reaction to the fungus, which can lead to blistering on the feet or hands. It's also possible for the fungal infection to return after treatment. There can be more severe complications if a secondary bacterial infection develops. In this case, your foot might be swollen, painful, and hot. Pus, drainage, and fever are additional signs of a bacterial infection. It's also possible for the bacterial infection to spread to the lymph system. A skin infection could lead to infections of your lymphatic system or lymph nodes. Long-term outlook. Athlete's foot infections can be mild or severe. Some clear up quickly, and others last a long time. Athlete's foot infections generally respond well to antifungal treatment. However, sometimes fungal infections are difficult to eliminate. Long-term treatment with antifungal medications may be necessary to keep athlete's foot infections from returning. Prevention. There are several things you can do to help prevent athlete's foot infections. Wash your feet with soap and water every day and dry them thoroughly, especially between the toes. Wash socks, bedding, and towels in water that's 140 degrees Fahrenheit 60 degrees Celsius or higher. Combining washing socks and application of OTC antifungal recommendations should treat most cases of athlete's foot. You can disinfect your shoes by using disinfectant wipes, like Clorox wipes or sprays. Put antifungal powder on your feet every day. Don't share socks, shoes, or towels with others. Wear sandals in public showers, around public swimming pools, and in other public places. Wear socks made out of breathable fibers, such as cotton or wool, or made out of synthetic fibers that wick moisture away from your skin. Change your socks when your feet get sweaty. Air out your feet when you are at home by going barefoot. Wear shoes made of breathable materials. Alternate between 2 pairs of shoes, wearing each pair every other day, to give your shoes time to dry out between uses. Moisture will allow the fungus to continue to grow.